Well, good afternoon and welcome back to Best Practices in Community Associations. I'm your host, Tim O'Keefe, an Executive Director and Partner with KW Property Management and Consulting. At the onset of the coronavirus, KW was the first management company to create this webinar format for educating board members and owners in condominiums and HOAs across Florida. After hosting 13 consecutive weeks of COVID-19 webinars, we shifted from a weekly webinar to hosting them monthly. So today is our first monthly webinar. Our format is to provide an insightful perspective with knowledgeable panelists to help guide board members to better prepare, protect, and make decisions for Florida community associations. When we left off a month ago, the number of new COVID-19 cases throughout the state was declining. We were rolling out phase 2 of the governor's reopening plan. We were adjusting to our new way of living and re-engaging the public. We got used to wearing masks. We started going back to restaurants, getting our hair cut, going to the beach, attending religious services, and returning to work, all while keeping up with our favorite Netflix series that we started. Over the past month, we've seen a significant spike in COVID-19 cases. Florida now has more than 270,000 reported cases and nearly 4,500 deaths. Miami-Dade County alone has 70,000 reported cases, making up 26% of the state's total. Broward has reported 33,000 cases, and Palm Beach County has reported more than 22,000 cases. In just a month ago, on June 15th, Florida had 1,758 new cases reported in one day. This past Sunday, Florida reported 15,300 new cases in just a single day. Yesterday, CNN published an article calling Miami the new Wuhan, China, and as being the new epicenter for coronavirus cases. That's not a reputation we want to have. As residents of Florida, we typically focus on hurricanes this time of year, but COVID-19 still has our attention. Being one of the largest management companies in Florida, with more than 90,000 homes under management, KW has to worry about hurricane preparation in addition to controlling the spread of the virus and keeping our staff and owners safe in the communities that we manage. Our focus pales to that of our guest today. So let me introduce our panelist. He's still not ready to join, but he will be shortly. We're delighted today to have Jared Moskowitz join us. Jared is the Director for Broward County Emergency Management, and he was also appointed by Governor DeSantis in January 2019 to lead the state of Florida's Emergency Management Division. So that's a big job. Once Jared joins, we'll get started. But I do also want to add that Dr. Josh Lentjes, the Chief Medical Officer for Broward Health Systems, was scheduled to be on today's program. For many of you that have listened to our program in the past, you've seen Dr. Lentjes as many as 3 times on our webinars, and he's always done a great job educating us. But due to the challenges faced by the Broward Health Systems, Dr. Lentjes regrettably canceled today to address more pressing issues at the hospital. He was very apologetic, but we certainly understand that our webinar can't take precedent over his real job. So Director Moskowitz will be our sole panelist today and will bring a very interesting perspective. If any of the audience has questions today, please type them into the Q&A icon at the bottom of your screen as we've done before. And then if just another minute or two, Jared Moskowitz will join us and I'll start with questions. But if anybody has a question at this point, you're welcome to send them in and I'll be happy to do my very best to answer the questions. You'll see at the bottom of your screen, if you move your cursor, you'll see a Q&A icon, and you're welcome to click on that and use that as the means for sending your questions to me. So again, my apologies, but if you give us just another minute or two, we will get started. We certainly know that the new numbers for the state of Florida can be a concern for many of us, and rightfully so. So we're going to hear from Director Moskowitz on what that actually means. What are the statistics that are important to him as he looks at being able to implement programs along with the governor to address some of the challenges that we face today with hospitals getting filled up, the vaccine still isn't ready, and growing number of cases in Florida. So what does that mean as we've reopened? Is there going to be a plan for closing things down, or are we committed to staying open? And we'll be able to hear a little bit more from Director Moskowitz as soon as he joins us. But those are some of the things that are certainly on our minds as KW and we manage so many properties around the state, we get a lot of these questions. But one thing we have noticed, we're doing a survey right now with all of our clients to determine if we're seeing a trend in facilities closing down. I can personally tell you I haven't heard anything from our team of operators, so we'll find out. So there he is, Director Moskowitz, welcome. You're still on mute. There we go.
How's it going? Everything good?
Everything's good. So I kicked it off. I usually start. My name's Tim O'Keefe. I'm the executive director and partner with KW Property Management, and we appreciate you joining us today. I know you're a busy guy, so thank you.
Yes, it's been a little busy.
Where are you sitting? You look like you're in Control Central.
Yes, this is NASA Command. We launch rockets from behind. No, I'm at the EOC. This is what it looks like. The people behind me are not robots. Those
not
are
the
actual.
Batcave. We're not going to see Batman come flying by or anything, are we?
We are not. No, but with an expanded budget, anything is possible.
So I have introduced you as the director of emergency services for the state of Florida. And also indicated that you are, and just to be clear, you're still the director for Broward County Emergency Management as well as State of Florida's Emergency Management Division. Is that correct?
No, just I'm in charge of the state emergency management department. It had nothing to do with any county. It's I'm at the state level.
Okay, so when the governor appointed you as in this new role in January 2019, you became part of the state and left the Broward role that you had.
Correct. I was a state representative in the legislature, representing, Coral Springs, Tamarack, parts of some parts of Sunrise. So as a Democratic representative. So yes, under the laws, I had to resign that position to take this job.
Okay, excellent. So tell us a little about your background, if you don't mind, Doctor. Or if you go by Director Moskowitz, is that okay to call you that?
The director's fine. Dr. Moskowitz is my uncle, but
yeah.
I'm happy to take the upgrade. No, so. Look, I'm born and raised in Broward County, grew up in Coral Springs, eventually family moved to Parkland, went to Coral Springs Middle, Marjorie Stoneman Douglas High School, went to college at GW in Washington, D.C., came back down, went to Nova Law School, got myself elected to the Parkland City Commission when I was 25 years old and still a second-year law student, did that for 6 years, then got elected to the State House. I was there for 6 years, planning to complete my 8-year term. I had gotten reelected to do my last 2 years in the legislature. Obviously was there during the whole Parkland massacre, helped lead the effort to pass the Marjorie Stoneman Douglas school safety bill, the largest gun control, school safety, mental health package ever passed by the state. But then Governor DeSantis came and asked if I would be interested in fulfilling this role in his administration. Obviously, being from the opposite party, it was humbling for him to ask, and then obviously dealing with Parkland, I realized that this was a unique opportunity to help people in the state who need help. Didn't think I'd be dealing with a 1 in 100 year pandemic, but this is where I find myself, and so look, I'm just happy to be supporting the doctors and the nurses and the hospital workers, the first responders, the heroes on the front lines, making sure that they have the PPE that they need, that the hospitals have the nurses that they need to make sure that they can provide the services, and we can, unfortunately have to manage, this crisis. And
I mentioned earlier that Dr. Lentjes wasn't able to join us. He regrettably had to cancel because he's got pressing issues at the hospital too, and running the Broward health system. So he wasn't able to join us. So it's just the two of us today, Director Moskowitz. So all of our listeners today are in for a treat, being able to hear from you. Let me step you back just a few years. I read your bio and I saw that you became part of the Parkland City Commission when you were in law school. Like, what the heck motivated you to add public service to your plate trying to get a law degree?
So, I had always kind of been interested in politics and public service. When I was 19 years old, I was interning in the White House in D.C. and then worked at the Democratic National Committee and got to intern on a presidential campaign. And I kind of grew up around, public service, being able to, meet a lot of people that were doing that for a living or part-time. And so, truthfully, the way the story goes, it's really quite simple. I came home to my dad and I was like, hey, what do you think about, me running for Parkland City Commission. And I thought my dad would be like, you're focused on law school, you're in law school, plenty of time for that, go get your degree. And actually, my dad was like, I think that's a great idea. And the next thing I know, we're, launching my campaign, raising money, knocking on doors, meeting everybody in the neighborhood. And I'm explaining to them why I just believe I can do a better job than the current vice mayor at the time. And ultimately, we wound up winning by like 28 votes or something like that. It was like 3 or 4 more votes than were necessary that would have triggered a mandatory recount. And so it was a good lesson. I was living at home in law school to be able to convince a community why a 25-year-old kid, as they looked at me, and I looked way younger than I look now. I have way less hair than I had, the wrinkles and the bags under my, I was like fresh at 25. But it was a humbling experience to understand that, look, you got to go out and work. I outworked my opponent. If I had not done that, I would have lost, no question about it.
I don't want to bring you down, Director Moskowitz, but I'm a lot older than you, so look what you have to look forward to over the years. So
yeah, no, I think with surgery and medication, I can try to prevent that.
Okay, and you're a step ahead of me.
Oh no, listen, it's not you. So my dad, I inherit this from my parents. Thankfully, I think I have my grandfather's hairline rather than my dad's, because my dad just has hair on the side, the rest is all gone. And so I saw that in my teens, and I was like, I'm medication. I'm going to fix that with Propecia. And so far, so good.
So not only can you help us with COVID-19, you can help us with all the emergencies and hurricanes in Florida. You can help us with our personal grooming and our youthfulness too. You're the fountain of youth.
Yes. And eventually I need to find an eye cream. I think that's what I'm looking for next. So I'll let you know what I come up with.
Please do. So let's get into the heart of this. So we're still in the middle of this COVID thing. I talked about right before you joined some of the numbers that Florida has 270,000 reported cases. The Miami market itself is about 26% of the entire state, with almost 60 or almost 70,000 cases. So,
yeah, Dade and Broward are 40% of the cases.
Yeah, and so what I'm kind of curious about, what are the key statistics that you're looking for that really drive the decisions for the state, and what concerns you? Because I know part of it, there's more testing going on, so of course there's going to be more reported cases. But what are the stats that you look for when you start to determine, are we opening too fast? Do we need to slow down? Do we need to go faster? How do you determine that?
Right. So, those decisions are made by the governor. Obviously, he gets tremendous input from myself, the Surgeon General, and many others. I would proffer that I don't know if it was a reopening too fast, but what I do think happened is that there was this phasing. We're supposed to be phasing in a slow phasing, phase 1, phase 2, phase 3, phase 4, right? We've never gotten past phase 2. In some places, they're still in phase 1. So why is that? Did the phasing not work? Yeah, the phasing didn't work because we didn't go to phase 1 and phase 2. It wasn't adhered to. We opened up and it was, let her rip, okay? And that, some of that is personal responsibility on individuals, some of that is on businesses, and some of that is on governments. And so we collect, the phasing is, in my opinion, what has not worked. And that's not a Florida issue. That is a national issue. If you look at why we are in certain states, is just I don't think the phasing happened, and that's just human behavior. People were locked in their houses for weeks and months at a time. Society reopens, explaining to somebody that society is only opening at 25%, and you can only be with 9 people, including yourself. I think that's kind of where it was hard to adjust. Mask wearing is another issue. I've been talking about masks now for several months. And if you had told me that masks would become the political hot button issue of our time, I would have lost that bet and be broke. Because especially here in Florida, what doesn't make sense to me is we're used to having mandatory evacuations during hurricanes. So government is telling people to leave their house because their life is in jeopardy. And never once has that become a political issue in 2 decades. And here, a piece of cloth or paper over their face, that somehow became this battle cry about the Constitution. So I don't understand that. Just like I don't understand why people pick toilet paper over food in March. So I think those two things, the lack of mask wearing, and just the phasing, people not adhering to the phasing. It's like a balloon, that has water in it. You squeeze one side, all the water goes to the other end. So you can close this, you can close that. People will find other ways. House parties, warehouse parties, they'll gather, obviously, young people who, and I was a young person not so long ago, right? We think we're invincible. We always think we're invincible. Well, then the statistics in COVID are telling people that they're invincible, because all you hear all the time is this doesn't affect young people, this doesn't affect young people, this doesn't affect young people. So if a young person thinks they're invincible and then they hear over and over again that they're invincible, right? They're not going to wear masks, they're not going to social distance. And so, what we saw is like there was tremendous spread going on among younger folks, but then they go home and they're with their parents, or they go home and they live in a multi-generational home like in Dade County and they're with their grandparents. And so I think that's also what's dramatically contributed to the spread.
So part of your role as emergency management division, running that for the state, you have to think about all the different things that go on. How well prepared were we for a pandemic? Not necessarily this pandemic, but there's movies out there about pandemics, and you watch them now and you say, wow, this looks like a real life movie. Is this really happening? So how well prepared was the state for a pandemic versus what we ended up getting thrown at us so quickly and being able to adjust quickly?
So, I mean, listen, there's no staff in the country at the state level that's more prepared for dealing with disasters than the folks behind me. You're talking the last 5 years: Hermine, Matthew, Irma, Michael, Dorian. Nobody has dealt with that. In a lot of ways, we were able to do a lot of things quicker. We have warehouses that have supplies in it. We know how to do logistics. We know how to decompress our hospitals. We know how to activate our surge plans, because we've practiced all of that with hurricanes. A lot of other states, they're doing a lot of this stuff for the first time and developing these plans. But as far as being prepared for this sort of pandemic, is no doubt the country as a whole was ill prepared for this. I just think that's evident. I'll just talk about one piece of it, because I was very vocal about this early on. The idea that we didn't have in this country, we couldn't get PPE, right? It's tough to accept that in America we couldn't get masks and gloves and gowns in the numbers we needed them early on in this, and say we were prepared. We weren't. Okay, and I think that exposed some deeper issues in this country. We got to be able to make things like medicine and ventilators and masks and gowns and gloves, medical supplies. Globalization is great. It helps, get rid of famine and poverty in a lot of countries, which is good, because we help pay for that also if we don't. But we also have to be self-sustainable. It's a national security issue, and the idea that we have to, other countries can use this as a trade tool over our head or a leverage is unacceptable. In the very beginning of this, we weren't just competing with 50 states; we were competing against everybody but Antarctica, and so that's something that's got to be fixed going forward. And so, thankfully, right, this isn't Ebola, okay. If this was Ebola, this would be a whole different ball of wax. But this has still been extremely devastating to a lot of families out there. Families that have lost loved ones, families that can't, our nursing homes are closed. You can't go see your loved one. It's the right policy, but it doesn't mean that it doesn't come without a cost to do that. We're trying to keep people safe, but at the same time, families can't go see their loved ones. I mean, so there's just the toll this has taken on the country. For people who have lost loved ones, the toll this is taking on our healthcare workers who are working around the clock, the toll that is taking on parents who don't know what to do with their kids for school. The mental health aspects of all of this is something that no one's even talking about when this is all finished. And so it's tough to tell anybody that we were prepared for this. I just don't think we were.
Based on preparation for hurricanes, how far along did that make us prepared for pandemics, as far as just equipment, warehouses full of stuff, logistics? Is it 40%, 50%, 60%? Like, how prepared were we?
Yeah, I don't want to put a percentage on it. I mean, on the logistics end, we were more prepared than most states, right? On the warehousing of stuff, getting stuff in, moving it around the state, we knew how to do that because we've been moving generators and pumps and all sorts of food and equipment for years here in the state. So that gave us a huge advantage once we could get the commodity. Once we could get the commodity, warehouses, we have, an electronic system here called Web EOC in which counties can put in these missions electronically. Some of these states don't even have that because they're not used to having to fulfill mission requests like we are in the state of Florida because of hurricanes. So we had an infrastructure that allowed us to be more successful. And I really tried to lead the effort to try to explain to people what was happening really on the N95 mask issue early on. Now we have, 15 million masks on hand, 10 million gowns, 10 million gloves, 3.5 million face shields, thousands of ventilators. So, we have that on hand in a warehouse, and as stuff goes in, we're reordering, stuff goes out so that we can maintain a reserve. We created a hurricane reserve, separate reserve for hurricanes. We have kits to give people for hurricanes, so if they have to go to a shelter, if they can't go to a friend's house or a family member's house, and they have to go to either a non-congregate shelter, which is going to be potentially in hotels, or a regular shelter, which will be less people at a shelter. There'll be all sorts of social distancing, temperature checks. We're going to give people, a PPE kit. So, we're way more prepared from the commodity end of this now than we were in March.
When did you start really planning for this? Because we started hearing, now we hear, well, in October, November, government knew something was coming. January, February, it was pretty obvious. Like our company, we have 1,700 employees. We're not a huge company, but we started preparing at the end of January, early February. We heard this coming that, we put 1,700 employees at work every day and we're an essential service business. We got to get ready. So like when did the state really take note of this and say, we've got to prepare?
Yeah, so in February, we ran a training exercise to make sure that I could run this building remotely if we had a major COVID outbreak here and I had to decompress the EOC. So we did that in mid-February. That was very helpful. And we started ordering supplies in February. We had a tremendous amount of ordering in February, tremendous amount of ordering in March. What happened is that those orders didn't come in, right? That was the issue. The issue wasn't that nobody ordered stuff. Everybody ordered stuff. We ordered a tremendous amount of stuff, but it didn't get delivered. And then that's when, obviously, people freaked out and we had to start reinventing the wheel and started basically putting in orders, put eggs in 1,000 baskets and then hope, a couple of them come through. I had a boiler room here. I basically did logistics full time when that was going on in March and April. Every day I did logistics. It was being run like a Wall Street boiler room where I had, a dozen people in a room and all we were doing was sourcing stuff. And you had maybe a 10% success rate to actually find stuff and get it. And it was a bidding war that was going on because, everyone was, trying to get the same sort of supplies, and it was a finite resource.
What was your single toughest challenge that you have had to deal with so far during this last 4 months?
Well, I'll give you two. One personal and then one with the folks, back here. So for me, my family's back in Broward. So, in the beginning of this, I didn't see my family for a month and a half. And so I'm still, I go home on the weekends to see them. But, so being away from the kids has been tough, especially knowing that this is the new normal for now, right? This is not like a hurricane where it hits, we deal with the response, then we deal with the recovery. We see some light at the end of the tunnel. There's no light at the end of the tunnel here, right? We're spiking now, but then, maybe we'll plateau, maybe we'll come down. But at the end of the day, that doesn't go away, right? I mean, so we're going to be dealing with this for a period of time. So on a personal level, the time away from my family has been obviously just tremendous. My family quarantined basically without me, while I was here running the EOC. And I'm not asking for pity. I mean, I signed up for this, although I don't think anyone signed up for the pandemic, but I signed up for this job. But, the other challenge really is folks behind me. Again, this is not a sprint like a hurricane. This is a marathon. That managing my people is a significant challenge. To make sure that they get time with their families, they get time off, they're not burning out, taking care of their mental health. I try to do creative things around here, let people bring their dogs and stuff like that, because we're cooped up in this building all day long. People are wearing masks, they're social distancing. This is the longest we've been activated at level 1 in division history by far, by 3 times. And again, there's no end in sight. These people behind me know that we're going to be doing this in October, November of this year, right? This is going to go through Thanksgiving. This is going to go through Christmas. They understand that, and so I have to try to make sure that they feel that they're being their well-being is being taken care of. I mean, obviously, the other difficult thing, obviously, is that not for me personally, but knowing that outside of what's going on, and we're trying to do everything we can to mitigate that here. But this is a virus. It's a pandemic. There's just some results that there's nothing we can do about. But knowing that there are families losing family members, they can't see them in the hospital, they can't have funerals. I mean, that's just devastating. And so that's why we do what we do around here. We're trying to minimize that as much as possible. Which is why we're telling people they got to wear masks. We're telling people they got to social distance. We're telling people stay home if you can, telework if you can. Just because that restaurant is open doesn't mean you have to go. Just because the gym is open doesn't mean you have to go. And so that is all we have, right? We don't have anything else right now to fight against this virus other than wearing a mask and social distancing. That's it. That's all we have. Yeah, if you wind up in the hospital, we have better treatments now. We have remdesivir. We got, plasma treatments. They're not using vents as much. They're using more, cannular oxygen. But at the end of the day, we have nothing else. Okay, and so we really want people to understand that that this is going to continue, and government has a role to try to slow the spread, but personal responsibility also has a role. People have to step up and be a hero. It isn't just about you. You can help save the person next to you because you don't know what kind of underlying conditions they have or any of their family members if they bring it back into their home.
And I would have asked Dr. Lynch's this question had he been here, so I'll let you play doctor today.
Okay.
What are you hearing as far as a vaccine? When is there an expected time frame for a vaccine? And then once it's ready, there's going to be a mad rush to get it. How available is it going to be for Floridians?
So, I mean, listen, I can't tell you that I've read the latest medical journal on the vaccine, but here's what I would just say. I think people need to put this idea out that they're getting a vaccine in 2020. Okay? I think, and I think that's, again, a behavioral issue. I think there's a lot of people who have approached this like, I just got to get through, September and November. I just got to get to the end of the year. There's going to be a vaccine at the end of the year. I got to get there. Okay, if kids miss, just the fall semester, they'll be back in January. I just don't think that's going to be the case. A lot of these vaccines are going through the trials. Yes, there's good news. Like we saw yesterday, the stock market goes up because there's good news. But I just don't think anything is going to be readily available in 2020. And then let me say this, okay? Let's say it becomes readily available in early 2021, okay? How much of it available, how much you can get. We need 300 million doses, and so then that's going to be the next issue. And the issue after that is, I talk to parent after parent after parent. If the vaccine comes out on Wednesday, are you giving it to your kids on Thursday? And the overwhelming answer is no. So there's going to be this period of time, especially with parents and their kids. There's going to be this period of time where people are going to get comfortable with a brand new vaccine and whether they're willing to give it to their kids, to their family members. So there's going to be a lag time also, I just believe, until people get comfortable because they're going to want to see the science. They're going to want to see that it works. They're going to want to see that the side effects have been vetted. So if I could guess, because again, I'm not a medical professional, I think that maybe a year from now is when we're really seeing the vaccine out and probably slightly more prevalent. But I think 2020, this is what the rest of 2020 is going to look like.
So what you do with emergency management in Florida is politically really kind of viewed as being bipartisan. You were appointed by Governor DeSantis, however, you hail from the Democratic Party. In your role, how do you grapple with kind of determining the best means of managing emergencies like the pandemic if there are differences in a political approach? Do you ever run into that philosophical difference for yourself?
So look, I'm the same person I was politically. I have the same beliefs I had when the governor appointed me. He knows that. He knew that when he appointed me. And so look, the governor and I have different philosophical beliefs. We get into those debates. I'm not going to share those, obviously. We have those policy discussions. The governor's always afforded me the ability to make my viewpoint known, at the end of the day. But, look, hurricanes don't hit Democratic households or Republican households, and COVID doesn't affect Democrats or Republicans differently. Okay, disasters don't choose people by race or creed or religion or national origin or status or wealth. Okay, and nor does this disease. Rich people, poor people, different races, different religions. Everyone's getting COVID. No one has some sort of immunity to this, and so I don't approach this in any partisan way. My job is to make sure that our cities, our counties, our hospitals have the resources that they need, that I'm here to fill the gaps, whether that's opening up testing sites in minority neighborhoods, disadvantaged neighborhoods, whether that's making sure that I can send nurses to hospitals, that first responders have PPE. As far as I'm concerned, these disasters are supposed to be non-political. This is the first one that has been this political by far. We have never seen anything like this for a disaster like this to be political. But in fairness, we've never seen anything like this in modern times as far as a pandemic. And so everything is viewed for the political lens, how people get their information, what they believe to be true. Think about it this way. No one ever says when a Category 5 hurricane hits Bay County that it wasn't a Category 5, it was a Category 2. And oh, by the way, it didn't hit Bay County, it hit Tampa. We don't dispute those things. These things are just naturally accepted because they're fact. This whole thing is just all over the map of people, of what they're accepting of what it is, what it does, what the data is, what the data isn't. Do masks work? Do they not? Everything is up to debate, and everybody's an expert. And so, that makes it more challenging, obviously to deal with this. And so, it's just, we're doing what we can here, I can't worry about the partisan stuff. I just got to try to plow through that and try to just, be as effective as I can, whether that's internal, external, in operations, in policy. Just try to push for what I think is best.
Well, you have a pretty clear path, it seems like, of things you want to do. So I'm sure you're very effective at getting things done. A couple of weeks ago, KW, we did a webinar discussed managing hurricanes during a pandemic. And so one of the more critical decisions that has to be made during a hurricane is when do you have a mandatory evacuation? So how's that change your thinking this year during a pandemic and then trying to get evacuated? Where are people going to go? How are you planning for that? Because I'm sure that's top of mind right now.
Yeah, so we've been planning for that since March. In fact, I would say we've done more planning on hurricanes than probably ever before because we've been at a level 1 here since March. And so, I took a planning team early on and said, look, you're going to do just hurricanes with COVID. You're not going to be in the day-to-day COVID response. So think about hurricanes. Now, shelters and evacuations are all done at the county level. We help provide guidance. So let me tell you what we've been working with them on. So we've always said to kind of know your zone, know what evacuation zone you live in. If you live in an evacuation zone A, you're in a surge area, right? Massive flooding. Most deaths from hurricanes happen from the water, not from the wind. It's water that causes more deaths in hurricanes than the wind. And so, look, if you're in evacuation zone A and a hurricane is approaching, you're going to have to evacuate. Know where you're going to go. You don't have to go hundreds of miles. Go to a friend's house. Go to a family member's house. Go to a dwelling that might be safer than yours. And that's the new part that we've added in. We used to say know your zone. Now we're saying know your zone and know your home. Depending upon the strength of the storm, if you live in a home or a dwelling that is built to the latest code, and we're dealing with a Category 1, Category 2 storm, not a major hurricane, perhaps staying home is the best option for you. And so, we're telling people know your zone, know your home. If you have to evacuate, here's how you should evacuate. Friend's house or family member's house, then a non-congregate shelter, which is a new thing we're doing this year. We worked with FEMA to help get this approved for reimbursement. We have signed up hotels, hundreds of hotels all over the state. We'll put you in a hotel that has that is rated with the wind, has a generator in that, will feed you, and the state's going to pay for that so that our counties don't have to worry about that. The new law passed this year that every county has to have a pet shelter was legislation that I worked on so that people feel comfortable to take their pets. But COVID is going to affect everything with hurricanes, right? And it's going to affect human behavior of whether people leave, whether they don't leave. And going back to your political question, we have to understand that that's going to affect human behavior. So if you think COVID is no big deal and leaving, perhaps, it's no big deal and you're not worried about it, right? leaving and going to a shelter shouldn't be any concern, because it's not. If you think COVID is airborne and you have to wear your mask outside even when no one is around you, okay, then you might stay home even if you should leave. And so what we're saying to people is, listen, if you live in a mandatory evacuation area, we can mitigate against COVID. Social distancing, mask wearing, washing hands, we can mitigate it. But we can't mitigate if you live on the water or live near the water, or you're in a mandatory evacuation zone A and a massive hurricane is coming towards you. We can't mitigate that. We lost over 40 people in Mexico Beach in Hurricane Michael, and if those people had left, they'd be alive. And so it is extremely important for people to listen to their local emergency managers, to heed the warnings, to follow that, and then follow all the steps and guidelines on the mitigation measures for COVID-19. But it's not just evacuations and shelters. Obviously there's new CDC guidelines that have come out working with the FEMA and the Red Cross. No more than 50 people per shelter. Some of the counties are working with their school boards on separating people per classroom. So that's an interesting solution. Obviously make temperature checks at shelters, things of that nature. But how we do everything will be affected. We've gone out and we've purchased generators for the first time because we're worried that power restoration might take a little longer, because you're not going to see the same mutual aid coming in from other states. We always do feeding missions after hurricanes. Well, if you add in the unemployment rate and the feeding missions that are going on, I think the feeding missions will be even larger. So we're prepared for all of that. I hate to say this, at this point, it feels like responding to a hurricane is kind of just old hat around here, because we've done it so many times. We know what works, we know what doesn't. We've had after action reviews. It's totally different than what we're doing here with COVID.
So I know if you want to talk about your website that you have available, what's the website? How can people find it? What are you recommending for Florida residents this year during tornado season and hurricane season to have available for their family plan and business plans?
Sure. So the website's floridadisaster.org, floridadisaster.org. And last year during Dorian, we changed this because this was the lesson learned during Michael, which is why we've changed the guidance. We're telling people to have 7 days of supplies on hand. We want people to have 7 days of supply. So again, hurricane supplies and COVID things are different. So, you're not, during a hurricane, you're not going and buying meat. So these are your canned goods, your batteries, your flashlights. We want people to go out and get those things. We want people to do that now in an orderly fashion so that the supply chain can keep up with it. Obviously, the supply chain has recovered pretty nicely from the early onset of COVID, but they won't be able to deal with everyone trying to go get their hurricane supplies in a 3 or 4 day period. So now's the time to go do that. 7 days of supplies, have that on hand, so that you can weather potentially losing power for that period of time.
If someone does get evacuated, they have to move to a shelter. How are you handling social distancing in the shelters?
Sure, but it's by limiting the amount of people in the same space that we've used to pack hundreds of people in. We're only going to be doing, I said, no more than 50. So people will be socially distanced. In some counties, they may decide to put up, fabricated, plexiglass walls. Everyone will be in a mask. It'll be required. We have negative pressure machines on hand that we can install in shelters. We have, sanitation machines that will help clean these shelters. So we'll do everything possible to try to, again, mitigate against COVID-19.
And so, just recently we saw the Florida State COVID-19 update issued on July 10th indicated that, we're still in phase 2 for reopening. Are there any plans to roll back statewide, or is it still just let's move to phase 3? Or are we going to stay in phase 2 and try to get everybody to be more aware, wearing masks and doing some of the things that we all can do as residents of the state?
Right. So the governor said that we're on pause right now. So, for the indefinite future, there's no moving forward and phasing. That's what the governor said. You have 3 counties that are still in phase 1 and not in phase 2. Dade, Broward, Palm Beach are in phase 1. They're not in phase 2. And so that's all paused at the moment. Dade County has rolled some additional things back. They got curfews. The state got rid of all bars, so all bars are still closed in the state of Florida. There's a lot of things in Dade County that never came back. Nightclubs never came back in Dade County. Those have all been closed. The bars in Broward, those all been closed. And so, obviously, the governor is analyzing the data. Those local county mayors, city mayors, county commissions are all looking at that. They can continue to close if they want, obviously, looking to see what the right decision is. But again, it's like that balloon that we have found. right? You close the gyms, that population goes elsewhere. You close the nightclubs, they go to the restaurants. They close the restaurants, they go somewhere else. And so, I think that's continuing to be looked at to see if that is effective. Obviously we got to figure out how to get through this time. And so I know a lot of people are trying to figure out if, schools will reopen, how are you going to do that with this positivity rate? And so that's a month from now. Obviously, we'll weigh in with the Commissioner of Education, with the governor, give our opinion on that. We're helping supply masks to the Department of Education. We're helping supply masks to the Secretary of State for, obviously, the upcoming August elections. And so, we'll be here to serve the need, and the policymakers, will have to decide, obviously, those policies. And so, with that, listen, I really appreciate the opportunity. And hopefully we get a chance to talk more because it's slightly more common around here. But I got to get back to making sure I'm deploying nurses to these hospitals on the front lines.
We appreciate all your time. Just one last question. Does your phone ever ring in the middle of the night and you look at it and say, I just don't want to answer that today?
Yes, but I still answer it.
Well, thank you. Director Moskowitz, thank you for your service. Thanks for all you're doing. Thanks for helping keep Floridians informed and safe during this completely unanticipated pandemic. And we'd love to have you back another time. We thank you for your time. You're very knowledgeable. You're a fast tracker. I know we're going to see great things from you down the road. That Moskowitz name is going to be big in Florida someday. I know it.
We'll see. All right. I appreciate it. Thank you very much.
Thanks for your time. Appreciate it.